Hello, everyone. I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University, with a joint faculty appointment with Ross University School of Medicine. And in this lecture, I'll be talking more about clinical trials. Clinical trials are considered the gold standard in the level of evidence. So when we're talking about clinical trials, a lot of it is longitudinal, following up with the same patients, making sure that it's effective. Things like that. So when we're talking about non-inferiority trials, non-inferiority trials, it's a bit difficult to pronounce, but they're designed with the idea that new treatment offers advantages over standard treatment in certain important aspects. So the non-inferior margin is a predetermined margin of difference between the new and standard treatment that is considered acceptable or tolerable for the new treatment to be considered similar or not worse. So, non inferior, the word, the term, means not worse. So, making sure it's not making sure of what's better, it's just making sure what's not worse. So both relative difference and absolute difference methods can be used to define the non-inferior margin. And then sequential testing for non-inferiority and superiority is often performed. So going into the non-inferiority trials, let's talk about that first. If you looked at the some of these are very important studies to remember, and at this point you don't necessarily need to know all of these, but it's good to look into them. And this first clinical trial is looking at Rocket AF, Rivo, Roxaban once daily oral direct factor 10A inhibitor, compared with vitamin K antagonism for prevention of stroke and embolism trial and atrial fibrillation. So it's a long name, which is why you can tell, and this is common in many of the fields and subspecialties that you may be thinking about, is that they use acronyms to try to make sure that that describes a clinical trial. And this is how, in the words you'll see, this is how people communicate. A lot of the residency directors and program directors, they'll communicate using some of these instrumental trials. So there was a RELY trial, the TAVI trial, transcatheter aortic valve implantation, and the Everest 2 trial. So table 1 shows a comparison between new treatment being superior and the non-inferiority, like I was saying, new treatment not superior but not inferior, and then new treatment equivalent to standard, and then new treatment inferior and non-inferior, and then new treatment neither inferior not nor non-inferior. It just goes on. But are non-inferiority trials necessary? For conditions like AFib with proven effective therapies, it is no longer ethical to test any new treatment against placebo. Many non-inferiority trials used active controls as the comparator. In NVAF, any new or oral anticoagulants would need to be tested against warfarin as standard treatment for stroke prevention. Therefore, non-inferiority trial design with sequential testing would be suitable. So why would you be even doing a non-inferiority test? Well, it's new treatment may be that the non-inferiority for new treatment may be that the new treatment, while it may not be superior, may be cheaper or more convenient. or may have fewer side effects than standard treatment. So if there's something that you're trying to innovate, and it may not be as effective, but maybe it's having less side effects, and other things. So it's just that the orientation of all of this is a bit different. So choosing the non-inferiority margins, are you looking for the absolute risk difference or the relative risk difference? So some of these are looking at different measures. And these are margins that are considered in non-inferiority trials, and assumptions. And then there's the intention to treat, and I would encourage you to go over non-inferiority trials. There's so many different types of trials, and you can go through them. The superiority trials, those are interesting. Make sure that you understand these. They're able to demonstrate a new treatment better than standard treatment or placebo in clinical trials. So, examples of this is the Gusto trial, the SPAF trial, the NVAF, the CURE trial, and the STEAMI trial, and the Fourier trial, and the Charisma trial. So, each of these are separate clinical trials that you can go into and better understand how clinical trials function. So I urge you to go through like the Fourier trial, the Cure trial, Gusto trial. Go through them. Make sure you understand how all the results look. So this is not necessarily looking at a specific clinical trial, but it's looking at the different types of clinical trials that are available, and a little bit more detail about this, rather than what is available in the current textbooks. That's it about non-inferiority and superiority clinical trials with sequential testing. This provides a good overview on that. Thank you for listening.